Hello, my name is Thomas Swan. I'm working toward a Doctor of Nursing Practice degree at Westminster College and have developed this educational supplement on ketamine therapy as part of my Doctoral Scholarly Project. What is ketamine? Ketamine is an anesthetic medication that was developed in the 1960s and is known for its high level of safety regarding cardiovascular and respiratory function. It's the most common anesthetic used in pediatrics, veterinary medicine, and battlefield medicine, possibly the most commonly used worldwide. It's termed a dissociative anesthetic because it creates an experience of separation of mind and body in the patient. Ketamine is on the World Health Organization's list of essential medications and is considered a psychedelic due to the powerful psychoactive effects, though it works differently than the classical serotonergic hallucinogens. What can ketamine treat? Ketamine is currently FDA approved only for use in anesthesia, but it has a variety of off-label uses. Many of these uses came after the expiration of any patents, so there's little financial incentive to conduct studies to get FDA approval for these other indications. Some other off-label uses can include pain, such as acute pain or chronic pain syndromes like fibromyalgia or chronic regional pain syndrome. It's also useful in a variety of mood disorders, especially ones involving rumination, such as major depression, treatment-resistant depression, suicidal ideation, bipolar, anxiety, PTSD, and OCD. How does ketamine work? Ketamine is considered a promiscuous drug, interacting with many different receptor sites, but it's primarily an NMDA receptor antagonist. NMDA receptors work with glutamate, the brain's primary excitatory neurotransmitter. Ketamine exerts its effect through a use-dependent blockade of the NMDA receptors, but also reduces the action of inhibitory neurons. By doing this, it both interrupts rumination and promotes communication through alternative neural pathways. Ketamine's action on the NMDA receptors has been shown to create a signaling pathway cascade, which results in an increase in brain-derived neurotrophic factor, or BDNF. BDNF causes an increase in neuroplasticity by increasing synaptogenesis. There are several other potential mechanisms that have been proposed as well, such as anti-inflammatory effects, estrogen receptor, serotonin receptor, or opioid receptor activity, or its neuroexcitatory effects in general, which are similar to electroconvulsive therapy. Is ketamine safe? Ketamine was added to the U.S. Controlled Substances Act in 1999 as a Schedule III substance due to the view that it was being improperly used as a recreational substance. At high doses, some harmful effects such as respiratory depression can occur, but ketamine has shown to have a robust safety profile over the last 50 years of use in anesthesia, which is at doses many times higher than for mood and pain disorders. Mild side effects such as nausea, dizziness, or anxiety can occasionally occur, but they're short-lived and contained to the administration period and shortly after. Distress from ketamine's psychoactive effects is rare when the patient and environment are appropriately prepared for the experience. Studies have shown no physiologic addictiveness, though it can, like any other positive experience, create a psychological dependence when it's used inappropriately, and therefore must be used cautiously and respectfully. The World Health Organization reports very low rates of abuse or addiction worldwide and recommends ketamine not be labeled a controlled substance in order to ensure an adequate access and supply. Contraindications for ketamine therapy include uncontrolled hypertension, increased intracranial pressure, glaucoma, and active psychosis such as schizophrenia. How is ketamine administered? It can be given usually through the intravenous and intramuscular routes, but also used in oral, sublingual, and intranasal routes. IV infusion is considered the optimal route because it has full 100% bioavailability as well as a direct control of the intensity. There's also a very short duration of action, so should any complications arise, the drip can be stopped and within a few minutes the intensity is starting to wear off. Intramuscular injection has other advantages though. It's much simpler to administer and takes a lot less skill and supplies. Though it has a longer duration, and once the medication is injected, the patient is fully committed to the experience. The oral, sublingual, and intranasal routes are less common as they have a very unpredictable absorption, and so it's hard to predict the effects. Is treatment covered by insurance? The short answer is no. Because ketamine is off-label for mental health or chronic pain, insurance companies are not obligated to cover it. There is a form of ketamine called S-ketamine, which is an isolation of the left-handed enantiomer of ketamine. And it is approved by the FDA for depression through fast track and breakthrough status, but the manufacturer charges much higher prices for the medication, ranging from $590 to $885 per dose, despite a lack of evidence that it's any more effective than standard racemic ketamine. The FDA also requires 2 hours of medical observation and several other additional restrictions for esketamine use, which further raise the consumer cost. How long is the treatment? IV infusion usually takes a 90-minute appointment with a 40-minute infusion. The onset is immediate and peaks at about 10 to 15 minutes in, with residual effects for about 2 to 3 hours after. Intramuscular injection appointments usually take about 2 hours, with 2 separate injections done about 30 to 45 minutes apart. The onset is felt within minutes and peaks around 15 minutes in, with residual effects lasting for about 3 hours after. Most patients will see some benefit immediately after their first treatment, though it's usually short-lived. Treatment-resistant conditions, however, may take several treatments before any benefits become apparent. Most cases commonly require 6 infusions done over a period of 2 to 4 weeks, with many patients achieving significant symptom remission and improved quality of life. After the 6 infusion series, maintenance doses are usually required about once a month. What is the ketamine experience like? First of all, it's very dependent on the dose, with 4 proposed experience levels depending on that. First is the empathogenic experience, where users usually report an increased feeling of connection and serenity. Next is the out-of-body experience, where people feel disconnected from their physical form, but still retain most of their personal identity and experiences. Beyond that is the near-death experience, where the user starts to feel a complete disillusion of their physical form, and that's often construed as a sense of having died, though this usually is reported to have a cathartic quality to it. Beyond that is the ego-dissolving transcendental experience, where patients begin to lose any reference points for their existence as a human being. The psychedelic experience has been portrayed in a variety of ways, generally considered to be very powerful, incredible, strange, and even having qualities of spirituality and mysticism and transcendence beyond human concerns. There also seems to be a noetic quality, which gives abstract thoughts a concrete feeling, and this can enable patients to act upon the insights they gain during their experiences. The dissociative effects can also help patients with trauma gain a new perspective of their past and finally process and address these memories. There's a sense of being able to peek behind the curtain of reality and see the universe how it truly is. And some patients report feeling that the experience was much longer or even completely removed from time, even feeling infinite. Some common patient concerns include, is ketamine legal and what if they're drug tested? Ketamine is a Schedule III controlled substance under the U.S. Controlled Substances Act, but for that reason it's legal to be administered under a healthcare provider with Controlled Substance Authority. It is, however, illegal to use without a prescription, just like any other controlled substance, such as prescription painkillers. Ketamine therapy under the supervision of a healthcare provider is treated like any other prescribed controlled substance, and it's further not included on any common drug screen panels because it's not considered a problem substance. Ketamine's half-life is only 2.5 hours, so it's effectively cleared from the body in about 10 to 12.5 hours, and for this reason, patients are usually advised not to drive for the rest of the day. How to get the most out of treatment. By incorporating psychotherapy before and after ketamine treatments, patients can prepare for their mental journeys, create intentions, learn grounding skills to use during their treatment, and then afterward integrate their experiences. Ketamine's interruption of rumination and the increase in synaptogenesis give a unique opportunity for patients to progress more rapidly in eliminating troubling thoughts and behaviors and in developing positive neural pathways and coping skills. Some patients may benefit from ketamine-assisted psychotherapy, where ketamine is given as an adjuvant during the therapy session at a smaller dose. In this way, we get a psycholytic effect, where the mental barriers are broken down and difficult emotions and memories can be processed. That concludes my presentation on ketamine therapy. Thank you for participating, and I hope that this information will be useful to you in your clinical practice and that it's another tool we can offer patients to help improve their quality of life.